Hello, everyone. This is Max with Cryptosophy, aka Hidden Wisdom Cryptosophy, for the Specialist number 3. I've been looking forward to this since I failed the first attempt at a podcast with this gentleman due to outside noises. But I am joined today by an EMT, Nick Stevens. Nick, thanks for coming on the program.
Thanks for having me, Max. Great to be here.
So, EMT is emergency medical technician. How did you decide that you wanted to view the worst parts of humanity's gore and death and heart attacks as the first medical career you chose?
Well, it was a very naive view that I had. In high school, my guidance counselor told me to, follow my passion, what I enjoy doing, what classes I like. And, I really enjoyed biology, and I'd taken a lot of classes in that field of study in high school. And if you're going to go into biology in college, you might as well just go pre-med. And so that's what I did after I graduated high school, and realized that I don't have any experience in the medical field. And so I did some research on how to gain some experience, and saw that getting your EMT certificate or license would really promote a lot of experience that you could gain. And so that's what I did. I took a 2-month course in between my freshman year and my sophomore year of college, and I really enjoyed my ride-alongs and my clinical rotations, and then I just decided that that's what I wanted to do. So it worked out.
You want to go on to be a physician's assistant. That's what you're applying for now.
Right.
But is that the case for most emergency services people, or are most of them stick with the emergency services side of medicine?
I think there's a little bit of both from my experience, just because I went to university and I worked for my university EMS service, where a lot of the kids that work for that EMS system have the goals of going on to be a doctor, being a nurse, being a PA. But when I came back here, a lot of people want to go into firefighting, or they want to be a paramedic, and EMT is a kind of a stepping stone into getting your paramedic, which is just essentially a higher level of an EMT. So not here. A lot of people want to stay in the EMS system. With my experience here, it could be different in other cities, other places. But here, I think a lot of people want to stay in the EMS system, whether it's police, fire, be a paramedic, anything of that kind.
Yeah, it's sort of like it's something that anyone who's taken a CPR course has the first sort of inclination. I know it's far more technical than that.
Right.
But I know you've worked across multiple settings, being an EMT. I
Correct.
think if I remember, it was an amusement park,
Yeah.
a private ambulance company, and a children's hospital.
Right.
How would you compare? Well, actually, before we do that, let's do what does an EMT do?
So an EMT it can range from to be many different things. Mostly, it's to provide emergency medical services in a pre-hospital setting, mostly an emergent setting. So what I mean by that is providing medical care for someone until they're able to be transported to a hospital where they can receive more advanced care from more advanced practitioners. EMTs can work standby in a hospital. They can work standby, as I do, at an amusement park. They can be on an ambulance, actually transporting patients. There's just such a wide range of roles that an EMT can actually play in the medical system, where it's really hard to just categorize it as one thing, just because they're so versatile.
And there's 4 tiers of being an EMT, right? At least 4, all the way up to paramedic, which is the highest form.
Right. 3 or 4. No, you're right. 4. In most places. So it goes EMTB, which is like your most basic EMT that you can essentially be, to an EMTI, which is like your intermediate EMT, to an AEMT, which is an advanced EMT, and then you get to your EMTP, which is paramedic. There is just subtle differences in ranking those up until you get to the paramedic stage, and that's where it really is a difference maker, especially in pharmacology, just because paramedics can give so many more drugs than all the other tiers, if you will, below them. There's not a huge distinction between an EMTB and an EMT or an AEMT, although there is a distinction. Colorado EMTs, a lot of the EMTBs are almost to their AEMT without actually doing the training, just because of the outside certificates that you can get. You can get your IV cert, you can get your EKG cert, you can get just a bunch of specialty little certifications that inch you closer to being an AEMT, but not necessarily a paramedic.
And I think I read too that there was a significant difference in hours of training between the tiers.
Oh yeah,
and it was getting up into the 1,800 hours of training for paramedics.
Right.
Whereas the lower tiers didn't have as much training.
Meanwhile, I did 2.5 months to get my EMTB, and paramedics likely go into an 8 to 12 month total course, to where they have to do a didactic portion in the classroom, and then they have to get 500 plus clinical hours or rotations on an ambulance or in a hospital to be able to just take their certification exam and be certified. So,
what is the last sort of preliminary thing? Is what is the equipment that you use, and what equipment do you know how to use in an emergency situation?
There's a lot of things. It kind of depends on what your call is, and it's really difficult to just list everything that I'd have in an ambulance. If you had something trauma related, you'd probably have IV supplies, supplies to stop bleeding, a tourniquet, gauze, tape, just stuff to bandage that stuff up. But once you go more medical, say you have like cardiac failure or an instance where you have to do something more invasive, again, you have your IV supplies, but then you have a whole nother multitude of drugs at your disposal that can be given intravenously or orally. And I don't know, it's really hard to just describe all my equipment, because I could go through, like, you have your AED, you have your suction, you have oxygen, you have this and that, but it really just depends on the call.
Something that I read today when preparing for this was that the new ambulances have technology which sends patient data to the hospital. Did you have access to that equipment?
No. A lot of those ambulance companies, or a lot of those ambulances, will be found in companies that probably run a 911 system. The company that I work for locally here really bought our ambulances from other agencies that were handing them down to us, just because they were cheaper and we didn't have the capital to buy new ambulances. So we didn't really have access to a whole lot of that technology that you're talking about. But the fact that that's coming up the ranks is very impressive to me, just improving the efficiency of medical care that can be delivered in an emergent situation is rapidly increasing with each new development in technology, and it's pretty outstanding.
Yeah, and one of the most amazing things about the field of EMS in the United States is it didn't start until the 1960s.
Right.
And then it really didn't start until the 1980s.
Yeah.
So it's a field that is even younger than occupational therapy, which is really young.
Right.
I think that field started in post World War I with the disabilities that followed.
Right.
Just know that because I'm dating an OT. But so you've worked in 3 settings or more?
I've worked, so I guess you could count being a supervisor for my intramural program at college as one. So I guess technically 3, but it could be 4. So I've worked in an amusement park, I've worked on an ambulance, and I've worked in a hospital. And the reason why I throw being a supervisor for the intramural program on there is because I had to use a lot of my first aid skills in treating injuries that overly competitive, non-athletic college students get on a nightly basis playing flag football or softball or soccer. I've treated anything from broken arms to severe concussions to seizures, just based off of sports injuries. So that's why I throw that in there. But it's not really a sector of EMS that I participated in.
Well, it seems like the one that you had the most action in, almost.
Mm-hmm.
Besides maybe working in a children's hospital.
Exactly. It seems like I had something on a nightly basis.
Wow.
With that.
So yeah, letter of advice: don't take intramurals too seriously.
Right. That's hard to tell kids that are varsity athletes coming right out of their state championship in whatever sport. Telling them not to be competitive is a tough thing to do. So.
Yeah, except winning doesn't get you much as far as a resume goes, I guess.
It gets you a T-shirt and maybe a mug. So yeah.
Well, a question off that is across those settings, is there a most common type of thing that you end up treating as an EMT? Is there like a most common disease or I guess ailment?
I wouldn't say disease or actually you could say ailment, but one of the big things is minor trauma, so cuts, bruises. I don't want to say fractures, although that comes up quite often throughout where I've worked. But a lot of it is preventable stuff. So dehydration, not caring for one's own personal hygiene. Both of those things are preventable. Dehydration, being able to just consume liquids.
Just real quick there, what personal hygiene is avoided to call in an EMT? Because I'd never heard of that before.
Well, especially in the geriatric population, it's out of their control, especially in nursing homes, because that's a primary population that I served. Being on the ambulance was in nursing homes, and it's not necessarily their fault because they're in a nursing home and they require some significant at-home care just to essentially thrive. And so it could be anything like not changing their Foley catheter so that they can actually get urine out of their system, not changing that on schedule to where it builds up bacteria and it leads to an infection. There's a UTI right there that is caused by something, again, that could be preventable. Just changing it on time, changing it effectively and efficiently could lead to a decrease in the amount of UTIs seen in nursing homes. So that's what I mean by
hygiene,
like hygiene, personal hygiene. Although it's not personal at that level, it's more of the caregiver's responsibility. But the dehydration is key. We see that all the time in pre-hospital setting, at the amusement park, in a hospital setting. There's so many times where we see people just for dehydration. And a lot of times it's preventable. Sometimes it's not. Sometimes they physically cannot drink. They cannot consume enough water, either because they're throwing up or because they just have an inability to get that into their system orally. So then we have to start an IV. We have to get fluids in them a different way just for them to become hydrated and back to that quote-unquote normal resting phase that they're normally at. So,
and I mean, along those lines, what is the more severe things that you commonly see? And do those differ across settings, ignoring the overly competitive intramural player?
Some of the worst things I see, the most severe, would definitely be trauma. Just because that's very evident when you come up onto it. If someone has a laceration right down the middle of their head, you're going to notice that. But if someone's having a stroke, that's more of a medical emergency. You don't really see that other than the textbook signs that you see of like a facial droop or slurred speech, altered mental status, paralysis in one side of the body. That doesn't really shock you as much as a trauma does. And that's what you typically see in kids. That's kind of our most severe cases, is because kids don't really have a lot of strokes. They don't have a lot of MIs, which is another way of saying heart attack. They don't have a lot of those severe medical conditions that you would typically see in adults in emergency situations. They mostly have, or they've been in a car accident, or they've been hit by a car. That's like the most severe stuff that you see. Most severe stuff that I see coming off of the amusement park side of it would be kids falling off rides, kids slipping and hitting their head, and that's another trauma thing. Cracking open your head is more trauma. Just because I've worked with kids so much compared to adults, the most severe things that I see are trauma related or traumatic, physically, not necessarily mentally, or not medically. Excuse me.
And along the lines of trauma, I actually last summer took a biology of aging course.
Okay.
And there's a cadaver lab at Xavier University that has 2 cadavers in it, and I didn't faint or get queasy or anything, but there was something that fundamentally changed. I think the professor asked me to help him flip one over so we could see the spinal column. So there's something very weird about looking into a human body,
right?
Especially knowing that it's a real person.
Yeah.
Did you originally start your medical career fearing looking at human bodies and blood and gore and those things? And how have you dealt with seeing the trauma you've dealt with?
So, yes. When I was younger, I used to fear getting shots, fear getting IVs, blood drawn, anything like that, anything of that nature, I feared. This has actually happened pretty recently. When I was a senior in high school, my friends and I were out the morning or the night before, and then we stayed the night at one of our houses, and then we just decided to go to a movie in the morning. And I was like, I need to eat breakfast. Like, I haven't had anything to eat, but like, I'll go. I'll go to whatever movie it was. And about 20 minutes into the movie, one of the main characters was taking a piece of glass out of his side that he'd been impaled with.
What was the movie?
It was, I believe it was The Martian.
Oh,
a piece
yeah.
Of shrapnel. Or
yeah. Shrapnel.
Shrapnel. Yeah, thank you. I'm twisting my words here. But he took that out and it started bleeding. I was like, oh no. Well, that's making me a little queasy. And so I went up to go to the bathroom because I wasn't feeling very well. And I push open the doors in the movie theater, and the next thing I remember is just fainting right into a 3D glasses box. And everything goes everywhere, and everyone's like, call 911. I'm like, no, I'm fine. I just need something to eat. But that's like a perfect example of how I used to be, and part of what actually deterred me from wanting to go into the medical field. But I talked to my physician at the time, and he said, I had a PA who was looking over my shoulder, and we were doing the surgery, and next thing you know, she's leaning on me, and she's passed out. Like, and that's a PA student, someone that's actually had medical experience, fainting. And he said, I used to feel that way, but once I was exposed to everything, and my mentality kind of changed about what this actually is that's happening, it got a lot better. And so I decided to go with it, and I got my EMT cert. And, on one of my ride-alongs, I saw someone on a motorcycle get hit by a car, and it was an infield amputation, meaning like it hit at her knee, and everything below her knee was gone when we got there. We had to apply a tourniquet, and I actually had a little bit of responsibility of holding pressure on that wound, and I didn't get that queasy feeling. I didn't get that feeling of wanting to faint. Partially, I think because my adrenaline was pumping and my heart rate was elevated, but at the same time, I had a little bit of a role in that patient care. I had a little bit of a role in how that outcome was going to be. Holding pressure on that wound to stop the bleeding can actually be a pretty tall order to fill. And I think when I have a duty to serve someone that I'm taking care of right there, I think all those thoughts go out the window. I really analyze things. So when I'm thinking about all the blood and gore that's happening, then it really gets in my head. But when I'm thinking about what I can do to alleviate what's going on, it changes. And I haven't felt queasy about blood, needles, anything like that in a long time, and it's something that used to really plague me or prevent me from thinking about anything medical was the fear of needles and gore and blood, stuff like that.
It's very interesting. Fear has to be, because of its evolutionary basis, a self-centered emotion.
Right.
And I think once the task comes in, there's no self that comes in to get freaked out by it. But
Right, gets in the way.
Was the motorcycle accident your first case of trauma as an EMT?
So I was in a ride along stage where I hadn't gotten my EMT cert yet. I hadn't gotten my license. But I was doing a clinical rotation on an ambulance, on 911 ambulance, where that's what we rolled up on scene on, and it was really gory. So that was my first real gory experience. I mean, I've broken my arm before, and I've seen a compound fracture in my arm from just a sports injury, and obviously I didn't pass out on that one. That was when I was really young, so I don't know why that didn't happen, but. Other than that, that was probably the first gory thing that I've seen being an EMT.
Yeah. And have you dealt with a worse situation than the motorcycle in the field, as far as the evident gore or horror of rolling up on a scene in an ambulance and having to act?
So I haven't had anything worse traumatically than that, physically traumatic. What I have had worse is someone having an ischemic attack, which is a stroke, on the ambulance, and that's a little bit different. Just because you don't have the gore there, but you still have the sense of urgency of this person needs to go to the hospital right now because we need to find out whether this is a blockage in the brain or whether it's a hemorrhage in the brain. A hemorrhage in the brain is extremely has a high fatality rate, if you will. There's not a lot that you can do for a hemorrhage in the brain, even in a hospital setting. There just isn't a lot that you can do. It's not like a cut that you have on your arm where you can just stop the bleeding with pressure. It's in your brain, and so you can't just like hold pressure on the brain because your skull's in the way. So it's a different kind of animal. But to answer your question. I haven't had anything more gory than that in a pre-hospital setting. Being at a children's hospital, I have had a lot of gory stuff come in, but in a pre-hospital setting on the ambulance, I haven't had anything more gory than that.
And do you notice a difference in you when it's a child as opposed to an adult with sort of how it impacts you emotionally?
Absolutely. Just because I've lived that stage of my life, when you get an 88-year-old that comes in with a stroke to an ER, or you get them in your ambulance, you don't feel that level of empathy. Maybe you feel it for their grandson or for their son, just because you might be at that stage in your life. But with kids, it's a little bit different. Like when you see an 18-year-old kid come in that tried to hang himself, it takes me back to when I was in high school, and I had friends that tried to commit suicide. Like it really takes a personal. It makes it more personal. That's what I should say. Is when you see it in kids, it makes it more personal simply because I've lived that stage in my life. When I see someone come in with a broken arm, it really affects me because I've had that injury before. I've known what that 11-year-old kid is going through. And it makes me that much more empathetic and care that much more. And I think that as I get older, that will help me in my delivery of healthcare just as a human, simply because I'll be able to feel that sort of empathy. Working at Children's Hospital is definitely difficult, especially when I'm 23 right now, and when an 18-year-old comes in, I'm like, that was 5 years ago, and it could happen to me. Like, it's very real at that point.
You can answer this question at your discretion, but what is the thing that's most emotionally challenged you in your work as an EMT for the last 4 years? Maybe shaken you up, or really changed your mind about something, or that you thought about long after the role as an EMT was over?
It's unfortunate to say, and it might be a little bit off topic from directly what you asked me, but kind of the desensitization that you
Nailed it.
long words that you experience being a healthcare provider in an emergent setting is kind of the fear of succumbing to that desensitization that you get, and you don't want to become desensitized because you want to be there for every patient that you have. But when a kid comes in with the sniffles to the hospital, you're like, I could be treating someone that actually has an emergency right now, someone that actually is in diabetic ketoacidosis, someone that needs help right now, and you're coming into the ER with sniffles because you have a cold.
But it's been going on for 12 hours.
Exactly, but it's hard to put yourself in that patient's shoes when you know there's stuff out there so much worse. When you know that you could be using your skills for someone different, even though as an EMT you can't do anything about the sniffles. You can tell them to drink clear liquids, and take ibuprofen and Tylenol for pain and swelling of the throat. And that's like the most that I can do is instruct them on how to get this virus out of them. But I find myself, especially after being a part of traumatic situations, writing off a lot of these cases, a lot of the kids that come in with upper respiratory infections, with colds, simply because, I just know there's so much worse out there. But at the same time, after the fact, I think about it, and I'm like, that kid could be in the most pain that he's ever been in his life. That 5-year-old could be experiencing the most pain that he's ever felt in his life right now, and I'm writing it off. Like, who am I to say that's invalid? Like, you have this pain right now, and you're crying, and you're saying my throat really hurts. And for me to just say, you shouldn't, like, in my mind, I never say this to a patient, but in my mind saying, you shouldn't be in the ER right now. You should be in an urgent care or something less of an emergency setting because this is not worthy of it, is wrong for me to say. But it's so easy to fall into that pitfall as an emergency healthcare provider because there's stuff that's so much worse.
Yeah.
And so I think that's what's been most challenging mentally in my own experience as an EMT, is being able to feel and care for those kids that come in with a cold or the sniffles.
And are these usually overprotective parents that bring the less severe cases into a hospital?
Yeah, and a lot of them are the parents. A lot of them because they don't have a primary care doctor, because they have never really been told to go to an urgent care, so they come to the ER because they think it's urgent, and that's another thing, is that's their baby, that's their kid that they've had in the world for 5 years that they have a connection with, and that I don't. But again, it's the same kind of concept applies to where I'm saying, really, you brought your kid into the ER for a cold, thinking that in my mind. It's tough for me to sit back and realize that happens because that's their kid, and that that's the world to them, and to make sure that they're okay. And when they're in pain, they think that's an emergency, even though in a realistic sense, I step back and I say, your kid has a cold, but that cold could be huge for that family, and so it's really tough. It's really tough to really. And this could be because I haven't had a child yet.
Thank God.
Right, exactly. But simply because I don't have that sort of connection to a child, an offspring yet, that I think I lack some of that empathy of why you brought your kid in here. Why is he in here? Why isn't he somewhere else right now? Because it's quote unquote unworthy of being in the ER.
Yeah.
When really it definitely could be.
So sort of like the number one consequence of the seeing and interacting with trauma is desensitizing yourself to cases that are way, way less extreme.
Personally,
Yeah.
yeah, I think it varies provider to provider. But definitely as an EMT and working in the hospital setting, you can see a lot, and it makes it hard to really place importance on everyone that comes into the ER, just because at 9 a.m. you have a motor vehicle accident that killed both this kid's parents, and this, I don't know, hypothetically, this 7-year-old kid comes in and says, "Where's my mom?" And that is an extremely hard thing for anyone to hear, let alone be that kid and actually live it. That kid's parents aren't in this world anymore. They passed away an hour ago. You can't tell this kid that. But it's like when you have those kinds of cases and it affects you that much emotionally, it's so hard for you to move on from that and say, yeah, your sniffles are valid. Like, your sniffles are worthy of being in here. When we take care of stuff that's so extreme, kids that are literally at like peeking into like the darkness, like peeking into the light of passing on, of passing away, and you see that fine line between mortality and fatality, and it's really difficult to give other people your peace of mind when you've been at that point with someone, when you're trying to prevent someone from falling into fatality and trying to promote mortality.
This was actually a question that I had for later on.
Yeah.
But I'm curious how your understanding of the fragility of human life has changed through being an EMT. I used to have, and I mean, I'm still really interested in this concept, is a Roman concept called memento mori. And they used to keep skulls on their desks in the Renaissance to remind them that death was coming and to clarify their minds in terms of that. Did you have a very different perception of death and human life after having seen some of the things you've seen?
I realize the fragility of it. That's definitely something that I've thought a lot about. Is how fragile human life is, and actually how short human life is. When you take care of someone that, like a 16-year-old kid that tried to commit suicide, you realize like it puts yourself in that experience of like, wow, this kid has 70, 60 plus years to live, and they're at the point in their life where they're trying to like end it. Yeah, when you see kids at that stage of life, it really makes you think of like my life could end tomorrow. I'm not saying that it will, but it very well could. Like we're humans, like stuff can go wrong. Yeah, beforehand I didn't think of how fragile the human life is, and when I see reckless behavior come into the ER, it really like. It really makes me like just kind of cringe, because they don't have the realization that I have, because I've seen it every day that I work there, of kids being like at the end stage of their life, and it's like, wow, you're 8 years old and you're at that stage already, like, and then this kid just like got into a car accident because he needed to get to his practice and he was running a red light, like stuff like that. Yeah, it's definitely made me realize how fragile the human life is, and how one thing can really affect that life.
I think one of the most interesting illustrations of this, and I'm pretty sure there's an online calculator for it, is you can type in your age currently, and they use the average death statistics, but you can see your life illustrated in dots per week. And when you look at the final chunk of dots, you're like, holy shit, this is almost over.
Right.
And yeah, there is that perspective. Has that shift in perspective changed anything for you in the way you approach your life or interact with people?
Yeah, it makes me want to take chances more. It makes me want to take chances with friends, with experiences, with significant others that I'm interested in. Before seeing all these traumatic experiences vicariously through other people, I used to be very, just, I don't want to say passive, but I will use that word, just in how I pursue things. I'll say, oh, I have time. I'm young. I'll get to it eventually. I'll graduate college eventually. I'll go to PA school eventually. But when you see how short this life can be, you really take advantage of the time that you have. Simply because in the grand scheme of things, you don't have a lot of it. And it's very cliche to say, life is short, like live it to your fullest. But like when you actually experience how short life can be, it makes you want to take some more chances, and it makes you want to pursue what you want and desire more. I don't like you want to pursue it more urgently. Is a good way to say it. You want to be more urgent about that. So yeah, it's changed quite a bit on how I look at friends, how I look at schooling, my career, people I'm interested in as a partner. Like all that's changed after being an EMT, and it's something that I didn't think would happen because it's just a, I say this now, it's just a job, but it's not just a job because it influences how much you think of outside of being an EMT. It makes you really reflect on your whole life as one whole, essentially. That's something that I didn't think would ever happen, but it has. Yeah, it definitely has.
Yeah, one of my favorite intellectuals, Sam Harris, has a great podcast introduction about death, and I think.
Okay.
The way he put it is you're playing a game right now and you can't see the clock.
It's true.
And I think that one of the best medicines for alleviating the petty things that people manage to be emotional about on a day-to-day basis is to recognize your mortality. And in light of that, almost everything dissolves that we would attempt to indulge in ourselves.
Right.
Tiny frustration or impatience or whatever it is.
Yeah, you slowly realize that it's not, I don't want to say worth it, but it's not worth wasting. And this is another term that is tough to use, but wasting your time over it.
Yeah, certainly. I wanted to switch gears and do a couple more of the micro level questions, but I am really happy we got to talk about death.
Absolutely. It's very prevalent.
Seems, that and taxes and a few other things are inevitable. Do you see any, I'm actually forgetting what research I'm talking about, but it's come up in my reading recently, a bunch of mental health issues that result in medical issues. What is the prevalence of cases that are, I think maybe psychosomatic's the word,
okay,
that you've dealt with and that the perhaps EMTs deal with more generally? Is that a very rare thing?
To deal with mental health?
Yeah. I mean, not in the action like suicide, but like as the sort of reason that you're treating them, if that makes sense. Like it's all in the brain, there's no physical ailment. Or does EMTs just completely stay away from mental health?
So it's tough because you don't get a lot of training in it. You don't get a lot of training in dealing with mental health as an EMT because it's not treated as an emergent case. What it is, so I've been fortunate enough to have taken many psychology courses in university, stuff that a lot of other EMTs don't learn with their EMT certificate. I'm not saying that they haven't learned it outside of this, but something that's not included in their cert is how to deal with people with mental health. Being on the ambulance, you do a lot of psych transfers, is what they call it, especially with private ambulance companies, where you pick up someone who came in with schizophrenia from wherever. They could be homeless, and they come into a local medical center, and you have to transport them from there to a mental hospital or something like that. And the most prevalent thing that I can think of with mental health is a male who was released from jail after serving a 2-year sentence just a couple days ago, and then he goes into the ER saying he hears voices in his head. This male is 6'7", 300 pounds, huge guy, and you're asking him to be transported by me. I'm 6'5", but I'm also a $190. I have nothing on a 300-pound male, and a female EMT who will be driving that's 5'4", 110. And being in the back with him as he's going through the process of, and he knows he has schizophrenia, but he's been off his meds for so long. And he's been off of therapy for so long to where he has lost control of, or any sort of control that he has over it. And watching him go through these cycles of talking out loud, and he thinks he's talking to someone, to me being in my quote unquote reality, I'm not hearing anyone. I don't hear anyone talking, but he's responding to what me sounds like nothing. And then he turns and looks at me and he's like, "What are you doing on my computer?" And I have to be honest with him. I can't lie, because that's altering his sense of reality. And I have to say, yeah, here, this is what I'm doing. I'm essentially just charting what the numbers are on your vital signs. I'm essentially just charting your demographics, your information, and that it's a big part of EMS is developing rapport, developing a connection with your patient. And in mental health, it's really difficult in patients that suffer from some sort of mental, I don't want to say disability, but ailment. It's really tough to develop that rapport just because you don't know their reality. It's easy with someone that is 30 years old and has kids, and you ask about their kids, and you ask about what they do in life and what they do for work. It's not like that with someone with mental health or mental health issue, which is a big challenge. But back to my story about this guy is I have to show him like what I'm doing, and then I ask him about his reality. And I ask him, "Oh, when you were down by the river the other day, you were talking to 4 other guys, and then one of them pulled a knife on you. I don't know if that's true, so I'm going to indulge in that reality." And I might be totally diverging from your question at hand, but
no, not at all.
But being able as an EMT to effectively communicate to your psych patients is very difficult, just because you don't receive that training. And you see mental health in the news all the time. You see it with depression, you see it with suicides, you see it with these school shootings that are going on, and that mental health is a huge part of that conversation, how to prevent all this from happening. Okay, and I really don't want to go into the point of whether people agree or disagree with mental health being an issue in those kind of situations, but it's having more of a prevalence in society, and the fact that EMTs don't have that kind of training is a little difficult. And we'll go into one more story just before.
By all means.
Before we go on, we were called to and this was in the ambulance again. We were called to a kid right across from in a suicide center, a crisis center, if you will, right across the street from a hospital. He's literally a 1-minute walk from the ER. We get called out there, and we're like, really? This is like a 1-minute transport. Like, can't they just walk him right across the street to the ER? So we were confused going in, but we get in there. My fellow EMT kind of says, "I'll take the lead on this one. I'll take this call." I had the past 2 calls, so it's like it's her turn to do a call, and so we go in there, and she gets the description from the crisis center staff, and it was a kid who was coming down from the mountains, and he's had a lot of mental health issues. His parents were he's adopted now. He's in the care of his grandmother. He was in foster care, now he's in the care of his grandmother. His parents are both incarcerated, and just a lot of stuff going on in this kid's life. And he tried to jump out of a car going down I-70 from the mountains. And that's like something that's pretty hard to handle as a 7-year-old kid that's at that point in their life where they're like, nope, I want to jump out of the car.
And just for anyone listening, so they know, I-70 is the windy mountain road to get all of the ski areas. There is no safe place to jump out of a car on that road.
Yeah,
there's no soft landings. There's a lot of cliffs and hills and rocks, and it's a really safe road. But just so there's some context, it is a winding mountain road.
Thank you.
Yeah, of course.
For clarifying that for the listeners. But he gets down to the crisis center, and they inform us that he's a runner. Like, if he gets any chance to run out of this crisis center, he will. Now, they legally cannot say, you're not going out of this crisis center. If he wants to leave, and if he tries to leave, they can't stop him. But they're trying to persuade him to stay until at least we get there, and we can either call police to get a mental health hold on him to where we can legally hold him against his will because he's a minor, or get him to voluntarily go. And so my partner goes into the room they're sitting in. He's like, I'm not going to the fucking hospital. Kind of taken back that a 7-year-old kid says stuff like that. But she stands above him. And if you know anything about patient care and feeling a connection with someone, a huge part of it is physical appearance and the way that you present yourself to that person.
He's 7.
He's 7. He's sitting in a chair, and my fellow EMT stands over him, talking literally down to him, saying, yeah, well, here are options. Like, you can go to the hospital with us, or you can go back home with your grandma. And he says, fuck that bitch. And she says, wow, she really cares about you out there. Like, she's crying. Like, can't you see that she cares about you? And in my mind, I'm like, oh, come on. We're focusing on the facts right now that he's upset about. Like, why are we aggravating his level of anger? Why are we heightening that? Yeah. And he says, she doesn't care about me. Like, why would I go with her? And you can see that this kid's getting aggravated. And I don't want to humble brag here, or I don't want to toot my own horn, but I kind of, just because we haven't had this training getting our EMT, I kind of tapped her on the shoulder. I said, why don't we just sit in this chair right here? She sits in the chair next to him, and I kneel next to her, and we talk about his favorite shoes. I see the shoes he has on. It's a brand that I love. And I'm like, dude, those are some sweet kicks you got on. Like, what's going on with those? How'd you get those? And he's like, oh, dude, my mom got them for me when I was 6 years old. Like, I've had them for years. I mean, but like they're holding up great. And I keep asking questions to build a rapport with this kid on stuff that he likes, like what he likes doing. Oh, he loves skateboarding. So let's talk about that. On I-70 driving by Idaho Springs, there's a skate park on the right. So I'm like, have you ever seen that skate park, like driving down the highway? He's like, yeah, I've always wanted to skate it, but like I haven't had the opportunity to. And then once you build that rapport, you say, all right, man, so like the reason why I'm here is so we can, like go to the hospital, get you some help. Like, I know you're not feeling the best right now. Like, you're feeling pretty upset. Like, how about we just like go take a drive over there? And making it so casual and not focusing so much on the fact of, wow, I'm having problems right now. I wanted to literally jump out of a car. Yeah. Kind of focus to where we're just saying, we're just taking a casual ride to the hospital, and we'll talk about skating and basketball on the way there. Like, it'll be totally okay. But we need to get you some help. Yeah. It's being able to develop a rapport with those kind of mental health patients that you don't get training with in EMT school, just simply because there's no time for it in that course. You spend most of your time on medical diagnosis and trauma and what to do with CHF, congestive heart failure, and strokes and MIs, heart attacks, that you don't really have the time to go over mental health stuff. And I feel very fortunate that I've been able to learn a little bit about that to where I can kind of revamp my actions as to a way to communicate with someone that has a mental health issue. And long story short, we went to the hospital, and she was in the back with him, and although it was for a 1-minute drive, he actually tried to get out of the back because we went back to focusing on how much people care about him, and he didn't think so. And I stopped the ambulance, and we had to go back there, and he actually had 3 of his seatbelts unbuckled, like ready to go out. And it's just knowing how to connect with a patient and being so versatile to where you can be able to do that is difficult. very difficult to do.
Yeah.
And it's something that needs more importance in
Yeah.
my mind, especially in this modern day society that we currently live in.
Well, I think, I mean, at least with my experience with people who are depressed or people who have generalized anxiety, is you never start by focusing on the problem. And I think that was very interesting. I do want to go back real quick because this terrifies me a little bit. Do EMTs, or did you in the back with the schizophrenic guy? I really don't want to pass over that child because that was a remarkable experience.
Fine.
But do you have any safety precautions back there, or like was he tied up or anything, or were you just back there with him?
Nope.
Or do you have any self-defense mechanisms other than your fists and hands?
I mean, being able to keep one's mind off of why I am the bad guy or if I'm the bad guy really makes a difference. Because if you start losing that rapport, I mean, you're in a world of hurt back there.
Yeah.
Mind you, we didn't have a police tail, meaning we didn't have a cop car coming behind us. The nurse in the hospital said he'd been calm and cooperative the whole time, so there's no reason for us to think that he's going to do anything.
Mm-hmm.
But you never know. You never know what's going to be that trigger to make it switch. So in the back of the ambulance, I remember we got into something. I knew I pressed a button because he kind of clenched his fists. It was just a question that was like, where you living now? And he was homeless.
Yeah.
And he's like, he kind of clenched his fist in frustration. And I kind of back away.
Mm-hmm.
I kind of say something to diverge his mind from that because I can read his body language and how aggravated he's getting. But defense mechanism wise, this guy was just seatbelted in with 5 straps. His hands weren't restrained, his legs weren't restrained, his whole body was restrained just for safety precautions on a stretcher. Yeah. Just like every other patient that we have, whether they have a mental health issue or not. But his hands weren't tied down to the stretcher, his feet weren't tied down to the stretcher. I mean, it got a little dicey at some points, and at that point, we have a code on the ambulance to say there's a dog in the road, and that means you need help in the back of the ambulance. And I don't even know if 2 of us could have taken him.
Yeah,
it was that bad. But it was just, I don't know. It was very vulnerable not to have those kinds of safety precautions in place to where I said, if this guy flips, I'm kind of done. I will be pretty hurt after this.
Thankfully, she didn't lead on that one.
Right, exactly. She didn't take the call on that one.
Jesus. Have you ever heard stories about mental health cases where EMTs get harmed or in self-defense situations?
Absolutely. A lot of those turn out okay because mostly the people are trying to escape, not beat the shit out of the EMT or the paramedic. Mostly they try to take off their belts and like give a quick jab just to get out of the ambulance because they don't want to be there. Yeah. They don't think that they need the help. That's most of what you see. You don't see a lot of EMTs being attacked just because with our occupation, we take an oath to be patient advocates and really advocate for what's best for our patients. So we're there to help. And we make that very well known. Like, we're not the police. If you tell us that you've been doing drugs for the last 5 years, we're not going to report that to the police. Like, we're in no role to do that. We're technically the good guys, but because of our uniforms, we kind of look like the police, and people think that we're in cahoots with the police.
I'm kind of happy you are wearing your uniform now.
Right, exactly.
There is a badge, and it says large EMT on your back. Yeah, it is.
Not police, like it says on other people's backs. But yeah, it's tough. I have heard stories of people getting punched in the face, knives being drawn, even though they're at the hospital. Like, you got to make sure that you're safe first. And if that's compromised, you kind of got to take steps to make sure that happens. Whether it has a policeman riding in your ambulance or coming behind you if you need to stop, stuff like that. Safety is huge in EMS. You got to look out for yourself first and your patient second. It's really tough when you really want to be a patient advocate to look out for yourself first. But that's like EMT 101 is making sure you're safe before you try to care for someone else.
Yeah.
It's just like in an airplane when they say secure your mask before helping others. It's that kind of, it's similar to that concept.
Yeah. That's always been hilarious. Let your children die before you do.
Exactly. They have more to live for. Okay.
Is there direct communication? Is there like holes in the ambulance such that you can talk to the person in the front?
Absolutely. There's in most ambulances, you have a gap in between the front seat and the back, where you could yell, "There's a dog in the road," and they know you need help.
Yeah.
They stop the ambulance and they come right back there. So that's fortunate, but a lot of times, if your partner's incapable, I'm not saying mine was, but if your partner's incapable, it's tough to.
Yeah. And if you don't have any self-defense mechanisms on board, you're left to fists and hands and running.
Yes.
So that transfer seems rather sketchy.
It was. Yeah. It was a dicey one. She was like, I was looking in the rearview mirror and I was like, is this kid still okay? Like, she kept looking like, is he still okay back there with this patient? And I'm like, yeah, it got dicey a couple times. Like, thanks for your concern, though, of not being able to help.
You should have a warning signal that says, look, there may be animals in this area you might want to look at. Right,
exactly. I think there's a dog up there that might run into the road, but I can't see it for certain. Right?
Yeah, maybe.
Right, exactly.
I want to just, I guess in the closing, maybe 15, 20 minutes, move to some of the more macro questions of your field.
Okay.
And maybe more philosophical or moral questions. And one of them is, are there any controversies in the field of EMT that you know about? Sort of like political controversies. And I have one that you might be able to comment on, but if something comes to mind. One of them was, I think it was given to me when I was like 15.
Okay.
Or 16. It was when I had the organ donor on my license.
Okay.
Which, I think it's very strange if someone doesn't do that. But the story that I heard was EMTs or paramedics won't save you if you're an organ donor. And I think it was a sort of conspiracy theory, and I've fact-checked this with nurses and healthcare providers, but or if there's a different controversy. But I think there's this myth going around that if you have the organ donor card on your license, that emergency medical services is less likely to save you.
Yeah, I don't think that's actually a thing. Like, it doesn't pop up on our page for a patient. So when you get a call, you get a page from your dispatcher saying, this is the patient name, birthday, what's going on, here's the address that you need to go to, stuff like that. It doesn't say whether or not they're an organ donor.
We've checked the registry. Right. You'll save 8 lives right now if you kill this guy.
If you let him die. Because it's on a license, it's very difficult for us to know. And I don't see that controversy at all in the pre-hospital care. I actually haven't even seen it in the hospital. Although a lot of kids can use organs and transplants, but I never see people looking at licenses and changing their style of care just based on whether someone's an organ donor.
Had you heard about that before I brought it up?
I actually have not.
Okay. Yeah. The reason I brought it up is because I've heard it from at least 3 people like over the last 5 years of my life.
Really?
So
from healthcare providers?
No, from people who weren't healthcare providers, but heard that from someone else and said, don't do the organ donor thing. And I thought, that seems a bit Illuminati flat earth to me.
It's a bit excessive, especially because when you get your certification, you have a duty to act. As an EMT, as a nurse, as a doctor, you have to advocate for this patient. You have to essentially do your best to keep this patient alive. And it's not your ethical responsibility or moral responsibility to say this patient is going to be a veggie when they're older. Like, they have so much brain damage right now that they won't even be able to stand up again. They won't be able to even talk again. We're not going to save them. You have no right as a healthcare provider to say whether or not someone lives or someone dies.
Moreover, no one who is an EMT who might not have your biology and psychology that you took in college knows what the probability is on a patient that has been without brain function. That's a different specialty than your training.
Right. And that's something that doctors and nurses might know of, like, if your brain is without oxygen for a minute, this part of the cortex, what you're going to lose. I semi know of what part of what parts of the cortex correlate to emotions and what correlates to happiness and anger and whatever. But I don't really know if you're brain dead for 2 minutes, what your life is going to be like. I don't know. I'm just focused on keeping you alive. Whether that means breathing artificially for you, whether that's doing compressions on your heart so that your blood pumps through your system, and we just keep your brain like somewhat alive. Like, I don't really know, and it's tough for me to say what is too much and what isn't too much.
I think we could probably say with some confidence that most EMTs would not be able to have the knowledge to
You're spot on.
Kill you and make sure your organs get to someone else.
Exactly.
Okay.
And so you don't even have a lot of tools for that. I mean, you see the Office of the episode where they're learning first aid and they're learning CPR, and CPR stopped, the patient died. Check and see if they have an organ donor card, Dwight says. And then he says, get me some ice in a styrofoam bucket. And he cuts open the patient.
Or the CPR doll.
Exactly. We don't do that.
No.
Like we don't have a styrofoam bucket or ice or whatever. If you die, you die in the process of us trying to keep you alive. You die with us doing CPR. And we don't even have the qualifications to call it and say, you know what, we've gone through 5 cycles of CPR. We don't do anymore. If you have an hour and a half transport to a hospital, which is unheard of for doing CPR, an hour and a half, you do CPR for an hour and a half, whether or not that patient comes back or wakes up or doesn't wake up. You never pronounce someone dead in the field, other than some 911 systems that have the capability in their protocols to say, yeah, this person's actually been deceased. They've been shot to death. They've been stabbed to death. Police can come in and bring the coroner in. But if you have a patient that's alive and you start working them, you work them until you get to the hospital where someone else more qualified can call it.
I think that is the first conspiracy theory on cryptosophy that we've covered. But when maybe Descartes,
right? Exactly.
Philosophers, and his relationship to the Illuminati and how that created Apple and
exactly.
Regardless, when I said controversy, was there something else that came to mind? Or
no, not really, because. And this may be very naive of me to think, but we don't have a lot of differing opinions from society on the care that we provide. We try to keep our patients alive. We try to make sure our patient care is as good as it can be, as personal as it can be, and I don't think there's a lot of divergence in thought processes there. Maybe there is, and maybe I just haven't experienced it yet, but in my personal experience and what I know, there's not a lot of controversy other than like politics within EMS companies, but that has nothing to do with patient care. Like we're gonna not even go into that just because it's petty, stupid shit. But
maybe the homeopathy or the astrologer community might disagree with us at this point.
Exactly. But in my field, I don't see a lot of disagreement.
I mean, that's interesting. I think there's an interesting relationship between the way the public understands the profession and then the way the profession actually operates. And I think it's kind of funny how the professions that get the most attention are not necessarily the most consequential in that regard.
Meaning like healthcare professions?
Yeah, and even just things that draw more controversy, like maybe legal cases or something else. As far as the cost to human life or well-being, probably, we might want to go after people who do marketing.
Right, exactly. Not people that try to save your lives.
All right. So the lesson being donate organs.
Right, exactly. Be an organ donor.
Just to do a few wrap-up questions. Is there advice that you could give to people to not end up needing you? as far as
there's so much advice I could give. I don't want to go in the whole vaccination thing, but a lot of vaccines are effective. I'm just going to leave it at that.
they give you autism.
Right, exactly. They will all give you autism, and that's why they're effective. Staying hydrated is a huge one. Drink lots of water.
Especially if you're out and about.
If you're in a warm climate, regardless of whether you're in a warm climate or not, everyone sweats, everyone perspires, everyone breathes. And breathing, you expire water when you breathe. You notice when it's cold, you breathe and ooh, I look like a dragon. Like you're really expelling steam. You're expelling water. And so people need to remember to stay hydrated. Safety measures, basic safety measures, car seats for your kids, wearing your seatbelts in your car, not texting while you're driving. You put a lot of people in danger when you don't have car seats, when you don't have seatbelts, when you're texting, when you're driving. Not just you, but other people. And a lot of what I see is preventative. Taking care of your body, like eating well and exercising occasionally. I'm not saying you have to be a big bodybuilder or a marathon runner. But exercising occasionally really keeps your vascular system and even your musculoskeletal system intact. And I see a lot of obese people come in, and I'm like, your CHF could have been, your congestive heart failure could have been prevented from eating better or even just exercising twice a week. Like a lot of things are preventative, and I think what will save a lot of humanity in general, especially in the U.S., is preventative medicine. Yeah. Brushing your teeth, drinking water, brushing your teeth being like dental preventative care. Yeah. Drinking water, eating properly, exercising every now and again, doing stuff that you enjoy doing, not getting too consumed with school or work. As we see mental health start to become more prevalent in this country, those are huge. People don't think, oh yeah, I should go ride my bike because I like riding my bike, but I have an exam tomorrow that I really need to study for. I'll study for exam for a little bit, go ride your bike and then study for the exam. Yeah. Again, having that balance there and doing stuff that you enjoy in life is really key to preventing a lot of stuff, a lot of shit that just permeates healthcare in the U.S. Right now. Yeah.
I mean, at least as far as the examples you gave, Siri now reads the text back to you. Right. You use the automatic Siri thing, so you don't have to look at your phone once. You just have to tap that microphone button.
Exactly.
But yeah, it's a bit fascinating how everybody knows that certain lifestyles will lead to certain consequences in some part of their mind, and how simple they are to undo.
Exactly.
And I don't know. I mean, I guess it goes back to our death conversation to a certain extent. It's fascinating how so many people pretend they're not dying, and yet everybody knows that this conscious show that we've been experiencing for X amount of years can't go on. Forever. Yeah. So are most of the cases you see preventable?
Yes and no. Like in the pre-hospital setting, yes. Especially at the amusement park, like kids that come in and say, "Oh yeah, I had Cinnamon Toast Crunch this morning, and I've had a big thing of Mountain Dew." But that Mountain Dew has water in it, right? Like, yes, you're technically right, but no, it has so much sugar in it that it counteracts that water. So those can be preventable cases, especially for dehydration. But in the hospital setting, it's yes and no. A lot of people come in with actual emergencies, actual mistakes, not knowing that they have diabetes, but they're feeling really crappy right now, and they didn't know they had diabetes, and now they're being diagnosed with diabetes. Like, a lot of it's emergency care, but a lot of it is out at home stuff where it's like not necessarily preventable for you to get a cold. Yes, it is preventable in a sense of you can use hand sanitizer before you eat. You can wash your hands before you eat. After you go to the bathroom, like after you interact with someone that's sick, covering your mouth when you sneeze and you cough. That can all help, but a cold is very hard to effectively prevent.
Yeah.
Although it is somewhat preventable, everyone gets sick.
Yeah.
I mean, you know, not everyone. No one has like the perfect immune system where they never get sick. But like, I think a lot of preventative measures can come into play with a lot of cases in the ED, whether that's following your medication correctly, whether that's acting correctly, whether that's eating correctly, whether it's just preventing sickness from spreading, infection control, doing that effectively. A lot of people are like, oh yeah, hand sanitizer isn't like effective because it like kills all the bacteria on your skin, but some of that bacteria is good. Well,
yeah,
yes, but like using hand sanitizer before you eat, after you go to the bathroom, like washing your hands, it does make a difference to preventing the spread of disease, especially in like certain seasons like winter where it's like it's cold season, you know.
Yeah.
So,
and I guess there's also the word preventable means different things to different people, given your understanding of science and medicine and so on. So, I mean, it's kind of a catch-all phrase that if you think that everyone should have a full understanding of health and blah, 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 which the average person doesn't, then you might define preventable differently. So
absolutely. It's all from my perspective, of course.
Yeah. I guess I'm seeing from your answer how the word preventable can vary. And then, I don't know, maybe this is more of a philosophical point for the field, but that we should get a rigorous definition of what we mean by preventable before we talk about it.
Absolutely. Because
it could be having a reading level over a certain place or
exactly, and sociologically, in one culture, preventable might mean something different from another culture. Like someone that grows up in, I don't want to say white suburbia, but like white suburbia is like, oh yeah, hand sanitizer is like a part of my daily life. But someone that grows up in a more impoverished area is like, McDonald's is like the only food that we can afford. So like, how is that even preventable? What do I not eat? Like, you know, it's different per culture, and it's hard to really define a rigorous definition of preventable just because it ranges so much over certain cultures. So
so generally wash your hands,
eat wash your hands,
don't drive a 3,000-pound vehicle and stare at another screen while you're doing it. Your brain can't do two things at once pretty well.
Walk to the place
if you're a woman, you're slightly better at this multitasking thing.
then
So there's just two more things I wanted to ask. I know the first one was, we see this played out in drama a lot and TV shows, but are there cases in which an EMT can save a life, but it's prevented by definition of what they're allowed to do? And then protocol says you can't administer such and such, you can't do such and such, and then that patient dies that you've heard of. Is there I could save a life, but I didn't because protocol?
Not that I've heard of, but I know it's out there. A lot of EMTs are very passionate about emergency medicine. You don't go into this profession for the pay. I'll tell you that much right now. You start at $11 an hour. That's like minimum wage in a lot of states right now. You get all these certs and you're like, wow, I'm in the process of saving someone's life, but I get paid $11 an hour.
Yeah, and also, I mean, just to add this in, that goes back to the licensed organ donor thing.
Right.
There's not a lot of room in $11 an hour to sacrifice your patient for an organ donation.
Exactly. It's like, what's that worth to you, right?
I apologize.
No, it's fine. But you don't. Can you go back to the original question? Sorry.
Yeah, it's in the situations where EMTs or EMTAs could save a life but aren't allowed to by protocol.
Yeah, EMTs are very passionate about medicine. You really want to learn about medicine, how to make the biggest difference in the world that you can make. A lot of people go into the field for that. They want to help people, and they do a lot of outside research that's outside of their scope of practice. They research why a medic can give epinephrine during a cardiac arrest and why that keeps someone alive. And they learn about the dosages so that they can help that paramedic by prepping the dose Sure, they're not giving that dose, but they're prepping the dose correctly so the medic can give it because they're authorized to give it. By protocol, they are allowed to give it. Again, that doesn't hold true with different states' protocol, but it does hold true with some protocols. And an EMT that's with another EMT on an ambulance comes across someone that's in cardiac arrest. And they say, yeah, we can do CPR. That's about all that we can do and give rescue breaths. That's it. And they have epinephrine on board. They have a vial of epinephrine. And they know the dosage. They know how much this patient weighs. They were told at the nursing home or at their home how much they weigh. And they know the dosage. They know how to give it. They know everything. But it doesn't say in your protocol that you can do it. It says that you are not allowed to do that. So, what are you going to do? A lot of EMTs, and rightfully so, would do CPR until they got to the hospital, and that's all they would do. Some EMTs would say, fuck that. Fuck the protocol. I know exactly what's going to save this patient's life, and I'm going to do it. I'm going to do CPR, and I'm going to give epi because I've already established an intravenous access, and I know how to give this. I know how to dilute it with the saline and everything. And let's say we compare the two similar cases. The EMTs that just do CPR and the EMT that does CPR with the epinephrine administration. One survives and one doesn't. What is right? The EMT that gave epinephrine saved the patient, and the patient's now walking and made a miraculous recovery just because of the epinephrine dose and the effects that it had on the heart, the cardiac muscle. You saved their life, but you acted out of your protocol. There's going to be repercussions for that. But did you do the right thing? Meanwhile, the EMT that did CPR and followed the protocol didn't save the life. So I think that there needs to be a revamp in some protocols, especially if you have the training for it. If you are an experienced EMT and you have been with a paramedic that's done that before and you know exactly what to do, I think there should be some training available for that. Now, if you're the EMT that knows how to do that epinephrine and just stuck to CPR, that kind of sucks because that protocol is not allowing you to do the skills that you know how to do. So I think our protocol needs to be revamped a little bit to reflect some of the experience that EMTs have had. I mean, you'll talk to EMTs that have 10, 15, 20 years of experience that have seen that it's done before, and they're like, I don't want to get fired, so I'm going to act within my protocol. I think it needs to be more micromanaged on what kind of experience EMTs have. And if you have a lot of experience, and you've seen this done, and you've had the training to do this, let's write it. Let's compose a protocol. Let's break down the tiers of being an EMT from an EMT B, EMT I, AEMT, paramedic. Let's break them down a little more. Let's make these certificates possible where they can do a 24-hour course of learning how to administer epi if they have IV access established. That can save a patient's life and not just have to stick to CPR, even though I know epinephrine. Sorry, I see that. Epi means epinephrine. I know epinephrine will save their life. I know it'll not save their life, but
it'll increase
the chances of them actually coming back for life. And it's a, I don't want to say it's a fault in the system because protocols are there for a reason and to keep patients safe. And if you don't know that dose of epi and you give them twice the dose and that overdose their heart, they're dead. That can happen. So they're there for a reason, but I think with more experienced EMTs and EMTs that are willing to do that training, it needs to be broken down just a little bit more.
Yeah, more than the 4 steps.
Right, exactly.
Have you heard of any stories or anything pertaining to that?
I have not. I know there's stories out there of EMTs acting out of their scope, and what I mean out of their scope is they have a certain protocol that they're allowed to do. They have certain things that they're allowed to do and certain things that they're not allowed to do, and they do the things that they're not allowed to do. I've heard of disciplinary actions being put forth by that. I've heard of EMTs significantly harming a patient doing that, and that's what those protocols are there to prevent that. I personally haven't heard of a story of an EMT acting out of scope that has positively affected a patient outcome.
Yeah.
That's something I haven't heard of.
Yeah, and I think, I mean, as far as the history goes, which we mentioned at the beginning, you're living in the 21st century where an ambulance with EMT and a paramedic or two EMTs can come to your house. It's like,
Right.
just rewind 70 years, which grandparents are still alive during, and you have a heart attack in your house. You're just dead.
Right.
That's it. And so I don't mean that question necessarily to criticize the field, but it's both so new and so remarkable that we have medical technicians that are able to zip down our streets if ourselves or someone we love is in that situation.
Right.
But I think there's a lot of medical technology and medical improvements that are on the horizon, and 100%. I think a lot of people are rightly skeptical of making too many changes in that system.
Yeah.
But yeah,
unknown.
I wonder if it's appropriate to judge a field by its youth, because then all philosophers would be put to the sword.
Absolutely.
For producing nothing.
But it's definitely in play. It's definitely you're definitely allowed to do that, because I mean, what are you going to trust? Trust is based off of credibility, and credibility is based off of time, in my opinion.
More than institutions and certifications.
Exactly.
Yeah.
Exactly. So
it's a very difficult line to walk unless we start, giving EMTs IQ tests and stuff like
then
that.
you're getting a little much there.
Exactly. Yeah. That's where the controversy begins, which is why we let people die. Regardless, we usually end our book podcast and now the specialist series on life lessons. So I was wondering if there was a lesson that you've learned, or the most significant thing you've learned from being an EMT for the last 4 years.
Yeah, that's tough to ask. That's going to require a lot of thought. But knee-jerk reaction is not to take your health for granted, not to take your life for granted, and to know how fragile it is and how much literally 1 minute can change your life. How 1 minute can lead to you getting in an accident. 1 minute can lead to your brain having a blood clot in it, to where your blood vessel bursts in your brain and you have minutes to live. Living life to the fullest, it's so cliche, but there's a reason why it's cliche. It's because there's a lot of truth to it. That's my life lesson. A big one for me is empathy, especially among people and their problems, and especially when friends or coworkers or even people I don't know reach out to me and they say a problem that they have in their life. Being able to identify with that person and really be there and understand what that problem is huge. And that's what I've learned the most being an EMT, because you've seen people at their best and you've seen people at their worst. You've seen people how they fabricate themselves, and you've seen people how they actually are. And being able to see that line and that dichotomy really is powerful in realizing self-realization of how I will live my life, essentially here on out. So
I really appreciate that. Yeah. The way I sometimes put it is, we're dying, and not even the most convinced religious person knows there's an afterlife.
Exactly.
So don't rush too quickly into that abyss.
Right. Yeah, a lot of it's a big thing going on right now. Is rushing towards that afterlife.
Everyone seems to be doing it.
Yeah, everyone. It's a new fad.
To die is the new fad.
Is the new fad.
I feel like that's a billion-year-old concept.
Right.
But Nick, thank you so much for coming on the podcast and for all your answers. I really appreciate it. And I don't know if this is said of EMTs, but I'm starting to appreciate their, quote, service as we do for other disciplines, because that's our grandmother with a heart attack in the back of that van.
Right.
And
it's very personal.
It takes a lot. So thank you so much.
You're welcome. Thanks for having me.
Yeah. I think coming up next, maybe, if this crazy psychologist can get off from treating addicts, trying to get him to take a day of work off that for a podcast with me. Armand might be up next, but I know we'll see the specialist soon, and I think tomorrow or the next day, Doyle and I will be doing a free verse podcast, and I don't exactly know the topic, but feel free to leave a comment below. All of my guests are open to coming back and answering those questions, and we'll cover that next time. Thank you so much for listening.